Well, thank you very much for the opportunity to be here. I think one of the challenges that we face, and something that we're acutely aware of within the American Veterinary Medical Association, is the fact that our public and media, indeed even our public health and physician colleagues, don't really understand this connection between animal health and public health, and that in fact by promoting animal health, we are going a long way towards promoting public health. A good example of that, and this goes back to my days with USDA APHIS, probably 4 or 5 years ago, as we were preparing for what we were concerned was going to be a worldwide pandemic from H5N1 avian influenza virus. I was acutely aware of the fact that we were spending literally billions of dollars in this country to prepare for a pandemic outbreak, that this virus was eventually going to find its way to the US, and there was a potential that the virus would mutate and be easily transmitted from person to person. We would be facing a 1918 type situation. So we were spending billions of dollars in stockpiling Tamiflu and developing a vaccine. And we were spending a paltry few millions of dollars in dealing with the virus at its source in poultry. And I think it probably took 2 years for the public health side of the government to understand that one of the most important things that we could do to prevent this virus from mutating into the all-feared pandemic virus and to reduce the risk that it would find its way to the US was to attack the virus at its source in animals. And that we in fact needed to be spending as much time and money and resources on attacking the virus there as we did in terms of preparing for a potential human pandemic. So I think that that is an example. Most of those types of situations have limited windows of opportunity to make change, and they're quickly forgotten. So I think we need to learn from those lessons in the past as we, again, make this connection between animal health and public health, and how we can promote public health by addressing the health of animals. Thank you.
Good morning. Thank you very much, Ryan. Thank you for the invitation to come and join this elite group up here. I'm honored, and I'm thrilled to see everybody out there. This is a very important issue, and one that's very close to each and every one of us, and I'm sure most of you probably even have pets, so you can relate very quickly to the catchphrase, the human-animal bond. This is something that pervades everywhere, internationally as well as domestically. And the role of a veterinarian is very, very, very critical to enhancing the health of the animal, at the same time protecting public health. It's actually part of our oath as a veterinarian, and one that we're very proud of. At the Center for Veterinary Medicine at FDA, it's one of the smallest centers. We have less than 500 people. And as you can well imagine, we have some of the most diverse issues because we have so many species, not just one. So on that note, it's very challenging for the industry that works with us to get approval of their products so that we can have sufficient products approved, can you imagine, for every single species, for every single indication, at every single dosage range, and that we ensure they're safe and effective before they're used. Very challenging. And so this is our purview, to work very closely across the board, internationally, to be aware of what those needs are and how we can work together. I think the sharing of knowledge is critical. The One Health initiative, One Health medicine, we've known that from day one. It's catching on now, and I really embrace this. I think all of us do. You're going to hear similar comments throughout the panel. You've heard them already. We are a village. Both microbes, animals, and people travel. And when we were in school being taught certain diseases, we were told, well, unless you travel to a certain country, you'll never see this disease. Not true anymore. Physicians and veterinarians are being taxed every single day with what is the potential diagnosis I'm going to have to pass as I examine this person or this animal. Moreover, what am I going to reach for to treat this person or animal? Is it going to be a drug? Is it going to be a vaccine? And what does it take to develop those? Only can we get there by sharing knowledge and team tagging and working together. And within the government, you don't do it alone. We're not islands. So it's more important that we share knowledge and team tag, and that's when I think the best of the best comes out from everybody. You bring the science to the table. You bring solutions. We bring groups together. And maybe these issues are challenging. We don't always see eye to eye. But I do think there's a theme through most of this that we all embrace, and that is one medicine and one health. And how we get there is the challenge of working together to team tag solutions. And that's going to come into play again internationally as we bring knowledge and awareness of what we're seeing and how we can enhance the communication so we can have a sentinel response. Animals are often a sentinel for upcoming diseases, as you just heard a minute ago. So with that purview, can we therefore be more reactive together to ensure the health of animals as well as people? And the environment comes into play as well. We are stewards of all of this together. And it's not us against them. We are there together. So the message that I'm going to share with you is one that you've heard right now. How do we all address these challenging issues? We're one small world. We cannot alienate each other. We need to team tag. And I think that's going to bring the best of everybody together to solve these challenging issues.
Thank you, Arnie. As Arnie said, I am a veterinarian. I'm also a farmer. Right now, we are in the process of getting crops in the field. We are done with our corn and working on our soybeans, and then we also have livestock. And so I have the honor and privilege to serve America's pork producers here in Washington, D.C. We represent 67,000 pork producers who have committed themselves, committed their lives, and committed their businesses to 6 ethical principles that we live by each and every day. The first one of those is public health, and obviously that's core to our discussion here this morning on the interface between animal health and public health. As we look at what we do on pig farms today, it's significantly different today than it was when I was a kid growing up in Iowa. However, with that being said, we take great care in doing what's right for our animals each and every day. Part of that is taking good care of them, working closely with our veterinarians to make certain that we have the herd health programs in place and looking and doing what's right for each and every animal every day. The other part that's important to that is using our medicines, those tools that we have in our toolbox responsibly and judiciously. We have an obligation to that. We have an obligation to our consumers and to our animals to use those products responsibly and judiciously. As Dr. DeHaven mentioned, I'm going to relate back to his H5N1 experience, because as I watched APHIS prepare for that pandemic, I thought, well, that's never going to affect me. I don't need to worry about that. And on the pig side, about a year ago this week, actually it was a year ago this week, we were faced with H1N1 in our industry. Very quickly, we went into emergency mode, basically. We worked very closely with USDA and CDC to put together plans to make certain that we were not only doing what's right for our animals, but also doing what's right for public health. We very quickly put out notices to our producers on how their employees could protect themselves as well as protect the pigs, because at the end of the day, we have an obligation to both. So with H1N1, we had a fire drill, and as Mr. Upton said, our producers did feel that, but we were committed to working with the government, and we're able to have the vaccine solution provided to our industry by the end of last year. So Arnie, I'll turn it back over to you, but look forward to the discussion. Thank you very much.
As a physician brought on board by the Humane Society, my focus of my research is really on the role of the human-animal interface in the emergence and spread of human infectious diseases. So whether we're talking about the bushmeat trade and the emergence of HIV/AIDS, someone butchered a chimp a few decades ago and now 25 million people are dead. Or live animal markets and the emergence of SARS, the exotic pet trade and the spread of monkeypox to Wisconsin. How we treat animals can have global public health implications. And that's why this forum is so important, and I'm so honored to be part of it.
There's been a lot of conversation, and it's important, about zoonotic diseases, diseases that move from animals to people. But what about day in, day out, as animals enter the food supply? Does health matter there? Well, what's the first job of our veterinary inspectors in plants every day, all day long? It's to make sure the animals are healthy. Ever since 1906, that's been their first job. Now actually that's mostly a wholesomeness issue. We make a distinction in FSIS between wholesomeness issues versus public health issues. However, unhealthy animals were responsible for implementing the largest meat recall in U.S. history when I was in the Deputy Undersecretary office, because unhealthy animals were being brought into the food chain. So obviously it makes a difference on the day in, day out meat production. But then there's another question that I've been, as a researcher, working on. Does subclinical animal health, animals that look good, they pass antemortem inspection, does that really affect the probability of foodborne illness? And actually we're finding out that it does. Just finished one study that showed as the number of pigs entering slaughter with what we call adhesions, as that number goes up, that pig that has an adhesion is 90% more likely to be contaminated with salmonella. Another study we did, which is published in the Public Health Reports, it's not in one of these wacko industry magazines. In that article, we showed that for every 1% increase in lesions in pigs, there's a 5-point increase in Campylobacter contamination. So to me, the take-home message is if we make policies impacting animal health, whether it's housing, drug use, stocking density, it's likely that each of those policy decisions are going to affect the number of foodborne illness cases or illness days. So it's important that we put that into our whole gamish as we ponder these important issues. Thank you.
Thank you very much. All right.